Now, Dr. Brown, you had mentioned about the bone mineral density test. So obviously, looking at somebody and looking for these compression fracture, we're still already having some fractures already, but the bone mineral density could be something that could pick this up earlier. So how is that test done, and what is it really measuring?
So the bone density test is measuring the quantity of bone, and it's a relatively straightforward test. They screen one hip and your lower back, and they look and they have an algorithm to follow, and the computer reads out how much bone is at these two levels. I think it's a wonderful test, and it gives us an idea of the quantity of bone. But one of the things that I think people need to remember is that a fracture, a fragility fracture, like that fall on the ice and breaking your wrist, is telling us about the quality of bone. So even if your quantity of bone is sufficient, if you fractured, we know your quality of bone is not where it's supposed to be. And I think it's that clinical judgment, looking at height loss, looking at the occiput to the wall, looking at the kyphosis, getting the history about fractures. It's that clinical overview combined with a bone density that helps a doctor make a decision as to whether somebody has a significant concern about osteoporosis and what is their fracture risk. Because the real question, Peter, is really, are they at risk for fracture? And we know that risk for fracture really means you're taking a chance with the rest of your life and independence. And
Yeah.
that's a scary notion.
Mm-hmm. And it sounds like there are many pieces that we have to consider, right? Not just the test of the bone mineral density. So Dr. Jain, in heart disease, right, we look at high blood pressure, cholesterol, diabetes, your weight, and smoking. We've sort of put these things together, and there are some calculations that we can do to predict who is going to have it. And is there such a thing for osteoporosis fracture risk, though? As can you predict somebody's future risk of a fracture over time?
Yeah, absolutely. And we know that certain characteristics predispose people to losing bone at an accelerated stage. So, so certain risk factors that are associated with higher risk of osteoporosis is if an individual is underweight, if their body mass index or BMI is less than 20, then that puts them at a risk of osteoporosis. If someone has taken medication from the family of steroids for an extended duration, then these medications tend to cause bone destruction if taken for a long duration. So that's one of the known side effects. If someone consumes 3 or more alcoholic beverages a day, that is one of the other risk factors. Certain medical conditions like rheumatoid arthritis, hyperthyroidism, hyperparathyroidism, in which parathyroid hormones go up, or insulin requiring diabetes also increase the risk of osteoporosis. If someone had a family member, so if either their mom or dad had a hip fracture, then that increases that person's risk of developing a fracture or osteoporosis as well. So we look at amalgamation of all these different characteristics. We may or may not consider the T-score, which is the bone mineral densitometry, or the BMD scoring that Dr. Brown was just mentioning, and incorporate it in this. And another very strong marker would be a previous history of fractures. And looking at all of these, we then are able to give a suggested fracture risk. But bear in mind, anyone who is, just like anyone who has had a heart attack, we know for sure they have heart disease. In the same way, if anyone has had a fracture, which is a bone attack, then we know for a fact that they have bone disease or osteoporosis. So these are individuals especially where the scoring will not matter as much because we know that they are at risk for future fractures regardless of their score.
Right. So it seems like quite a few things come together and we can assess the overall risk, and really it's about the fracture risk. So as both of you pointed out, that bone density test is one piece of that, but we also look at family history of fractures, you having a fracture, your age, medications that you might be on, and diseases that you might have that may make things go faster, and so on and so forth. And that all comes together. And Dr. Brown, is there a tool that you use to calculate such a risk for people?
So there is a tool called the FRAX tool. FRAX is FRAX. And it's a tool where you could put in all that information and then get out a percentage of risk. And what we know by the FRAX scores is certain numbers suggest that you've got a high risk, and usually that means in the next 10 years for having a fracture. There is a Canadian tool as well that divides you into low risk, moderate risk, and high risk. And I think that, lots of doctors are comfortable with that tool because it's a little simpler to use. But the bottom line is, for anybody that's had a fracture, what we know is for the next year or two, they are at imminent risk for another fracture. So when we look at 10 years, it's not like your risk is the same percentage every year. Your risk is highest in the first year or two after a fracture, which is why in the language of osteoporosis, we sometimes talk about fracture leads to fracture, because when you have a single fracture, your risk of another fracture in the next year or two is really high.
Oh, that's a good point, right? Because we always think about this as something down the road, but if you've had a fracture, your immediate risk is going to be high of having another one. And I guess we think of that for heart attacks, right? If you had one heart attack, you're more likely to have complications of that. But for some reason, I guess with fracture, we sort of lost that connection. So definitely important. If you had a fracture, you're at very high risk of another fracture.